The Federal Ministry of Agriculture and Rural Development have confirmed the outbreak of anthrax in Nigeria. This was contained in a statement with subject confirmation of first anthrax case in Nigeria, signed by the Permanent Secretary, Federal Ministry of Agriculture and Rural Development, Dr. Ernest Umakihe. Umakihe, in confirming the first case that was detected in Niger State, close to the Federal Capital Territory, FCT, on a farm, and confirmed on Sunday, July 16, 2023, by the National Veterinary Research Institute, VOM, Plateau State. According to the ministry, and I quote, the federal government, through the ministry and in collaboration with the Niger State government, has taken proactive measures to timely control and contain the disease. Such measures include quarantine of the affected farm, deployment of 50,000 doses of anthrax vaccines for ring vaccination of susceptible animals, species around the infected farm, educating the farm workers using One Health approach on the symptoms, preventive measures, and what to do when they notice any sign of the disease, end of quote. Joining us now on the show is Dr. Philip Oshun, a clinical microbiologist and infection control practitioner at the Lagos University Teaching Hospital, LUTH. He will be discussing the outbreak of anthrax disease in Nigeria. Good morning, Dr. Oshun, and welcome to the morning show.
Good morning, everyone. Nice to have you.
Good morning, doctor. Well, we first heard about this anthrax disease, infectious disease, just around the Muslim festival of Eid al-Kabir, when we were told that, look, everybody should be careful, getting rams because anthrax had been reported in the northern part of Ghana, in Chad, in parts of Togo, and in some of the other neighboring countries. But now we've been told that anthrax is here. It's infectious, it's in 3 different forms. If you could just educate us about what the disease is and what the risks are, particularly to human beings.
Thank you very much. Anthrax is a disease that is transmitted from animals to humans. It is caused by a germ called Bacillus anthracis. It is a bacterium. There are different germs. There are viruses, there are bacteria, fungi, but this one is a bacterium. And it's usually it's able to shield itself in very bad environmental conditions. And we call that formation of spores. Formation of spores means that an organism or a bacterium can hide and encase itself so that it can survive for a long time in the environment. And so when it rains and the animals eat, the spores can be found in the environment. The animals can feed on these spores, and the bacterium now comes alive and infects the animal. So if the animal becomes sick and dies, or the human beings that take care of these animals can become infected. So infection can be usually from animal to human. And how does that occur? By human beings getting in contact with the blood of animals, with the hides and skin, with the wool, with the meat of the animal. So that means that the people who are at risk mainly would be those who are in close contact with these animals, those that work in farms, the cattle rearers, the herders, the abattoir workers, the butchers, those who slaughter the ram, or the cows, the sheep, the goats, usually herbivores. And so the exposure can lead to 3 different types of infection in humans. The most common is the skin infection. So when there's an abrasion or cut in the skin and the organism is able to penetrate into the skin, it causes a skin infection, which can present with a sore on the skin with a black center. Patient can have fever, and headache and body pains. Then it could also present with symptoms that resemble food poisoning, because it can be transmitted by ingestion, by eating these sick animals. And so that is that would present like food poisoning, diarrhea, vomiting, sometimes bloody diarrhea, and if it gets severe, then it can present with other worsening symptoms. Then the last one, which is infrequent, which is not very common, is the one that affects the lungs. So that is by inhaling the spores. So that usually is not transmitted through this blood. But when there's a lot of spores in the environment and human beings inhale these spores, and that can occur when the sick animal is being slaughtered. So that's one of the reasons why they say sick animals should not be slaughtered, because the spores can be inhaled by humans, and that can lead to respiratory infection, respiratory failure, and death. So that's the worst of the infections, the pulmonary infection, the one that affects the lungs, but is the most infrequent. The most common is the one that affects the skin.
All right, thank you very much, Dr. Oshun, for breaking it down. Now, NCDC has said that anthrax is highly transmissible and it's quite dangerous, so in terms of watching out. And you told us ways in which it can be spread from animal to humans. How about can human to human transmission happen? How does this occur in terms of when someone is affected? And then what are the symptoms? What are the early symptoms? What should people be watching out for amongst, in this at this season?
The human-to-human transmission is not very efficient, so it's very inefficient human-to-human transmission. Like I've said, if you look at the skin infection, it's mainly through cuts. So if someone has a skin infection and the fluid from that skin infection gets into another person's cut or bruises, then maybe it's possible. But usually human-to-human infection is not very common. And even with the one that affects the intestine, it is ingesting the sick animal. And the one that affects the lungs is mainly with spores. So it's not when someone coughs it out, but when there's spores in the environment. Like I told you, the spores are the vehicle in which the organism hides and survives for a long time. So when those spores are released, then the inhalation anthrax can occur. So human-to-human transmission is not very efficient. However, the symptoms to look out for the skin, we look out for the rash, the sore, and the black centers in the skin. Then fever, other constitutional symptoms like headache, like body pains. Then when it gets worse, especially with the gastrointestinal, that's the one that affects the intestine, there could be diarrhea, vomiting, even bloody diarrhea. And with the one that affects the lungs, then becomes difficult to breathe, there could be respiratory failure, and that could lead to death.
Okay, so let's talk possible treatment. Since we've gone through identifying anthrax and all of that, let's talk possible treatment, and also let's allay the fears of people that, yeah, in some cases it could be deadly, but in some cases too, we've had people that have made good recovery from anthrax.
Okay, so most of the infections are not deadly. The ones that are mostly deadly are the ones that occur that affect the lungs, and that would be when the spores are released, and it's very infrequent, like I said. Most of the cases will be the skin manifestation, and so it is a treatable disease. And if anyone around you has these symptoms, or you have the symptom, you need to present to the nearest healthcare facility, where the healthcare workers would be able to assess you and determine whether you need treatment or not, and so there are antibiotics that can be used to treat anthrax. And so it's a very treatable disease, And it is important that patients or people present early to the healthcare facility when they notice these symptoms.
Well, Doctor, the Federal Ministry of Agriculture and Rural Development, in collaboration with the Nigerian Center for Disease Control, they've announced a number of measures. They say incident management has been activated. 2, they're going to launch a nationwide vaccination of sheep, goats, cattle all over. They're going to quarantine the farm in Suleja where a case has been reported. They say no infection with human beings has been reported yet. I just want you to assess those measures, whether those measures can really work. How do you vaccinate livestock all over the country, targeting goats, sheep, and cattle? Then my second concern is a layman's concern. They're saying, okay, this thing is animal to human transmission is possible. But I said something the first time this subject was mentioned, that look, even if any animal has anthrax, you cook it very well, you fry it very well. Will it not eliminate the anthrax? When we buy kilishi that has gone through the furnace, or dambunama, can anthrax survive? When the meat is very well cooked and everything is properly garnished with onion and pepper. But that's a layman's question. But the first one, your assessment of the measures being proposed.
All right, thank you very much. So, because the disease affects both man and animals, and also we've mentioned that it can be found in the environment. So it requires a multi-sectoral approach, which is a One Health approach that has been adopted, looking at the environment, the humans and animals. And that's why the NCDC, Federal Ministry of Health, and the Federal Ministry of Agriculture, they are collaborating together so that we can use the One Health approach. So because it involves animals, humans, and environment. So, and the most important measure is the vaccination. So that is the most important measure in terms of preventing the disease to spread in the animals. So for livestock, the most important measure will be to vaccinate. And there will be challenges with vaccination. Vaccinating animals all across the country is going to be a huge challenge. But I'm sure the officials at the Ministry of Health, of Agriculture, and the NCDC, they will collaborate together and design approaches that would help to ensure that the livestock are vaccinated. And I'm sure they would start from where the epicenter is right now and move outwards to other parts of the country. So this is not the first time we're doing vaccination, so I'm sure there are modalities in place for the officials, and the alert has been on for over almost a month or more than, so preparations have been in process for quite some time, so I'm sure they are up to the task. Apart from vaccination is also to quarantine, to keep the sick animals away from the healthy animals so that the infection does not spread like wildfire. So and it's also important that the carcasses of the dead animals should be incinerated so that the organisms can be effectively destroyed. So that is also important. Then concerning the layman's apprehension, the first thing is that we need to be more hygienic. The message needs to go out to those who work in the abattoirs, the butchers, the cattle rearers, the hunters, that sick animals should not be slaughtered for any reason. Because, like I've mentioned, slaughtering of these sick animals could release spores, and even those who are doing that can also get infected. So sick animals should not be slaughtered. They should be sensitized and educated so that they can report when they notice any sick animals within their livestock or within their farm or settlement, as the case may be. Then for the layman who goes to the market to buy meat, is to make sure that we buy meat from reliable sources and continuous education for those who butcher or cut or slaughter animals to ensure that they do it in an hygienic manner and they do not slaughter sick animals. Then at home, we need to ensure that we wash our hands when we prepare meat. We should wash our hands before we prepare other food, so we don't mix meat which has blood with other food materials when we are cooking. Then, of course, like you mentioned, we need to cook very well. It might interest you to know that the organism, that's the Bacillus anthracis, produces what we call a toxin, chemicals, actually causes damage to the humans and the animals that we've mentioned. So it is important that the toxins are destroyed. So we need to make sure that meats are processed properly in an hygienic manner, and we boil it very well, just like you said.
Well, thank you very much, Doctor, for joining us on the morning show. Thank you very much indeed. Dr. Philip Oshun there. Thank you.